So for the sake of this video, I'll be doing one side. However, in a clinical matter, I would do both. So I'll run through consent and what we're going to do, which is passive, active, and resisted range of motion. As you can see here, she's done cervical flexion. She's now going into cervical extension. And now into cervical rotation, both left and right. Looking for any pain or uncomfortableness here. And she's now going into cervical side flexion, bringing the ear to the shoulders. Okay, next I'm going to passively do these movements, bringing the head into cervical flexion and extension, cervical rotation, right and left, and then into side flexion. Asking if they're okay and not bringing it too far, just to a point of resistance. So now we're going to ask them to cross their hands across their shoulders, and then they're going to go into thoracic flexion and stabilise the lumbar by putting their feet flat on the floor. So that's thoracic extension. It is limited movement. And now we're going into thoracic side flexion. And thoracic rotation was before that. So now I'm passively doing these for her. This is thoracic side flexion, thoracic extension, and thoracic flexion. And lastly, thoracic rotation, both left and right, stabilising that lumbar. Okay, now we're going to go on to the lumbar spine section, where we're going to bring our hands down to the floor, going down your leg. This is lumbar spine flexion, making sure there's no pain or limited range of motion. Okay, now we're going to go into thoracic extension. Again, there's going to be limited movement here as well. And then thoracic side flexion. Lumbar spine rotation is limited, as it's mostly coming from the thoracic region.